This tape job is for great toe hyperextension, trying to prevent it from moving too far into extension if they've had a toe injury, often referred to as turf toe. You can easily reverse this tape job if the problem is hyperflexion that you're trying to prevent. As per usual, we want to check for any open wounds, ask if they've been taped before, check to see if they have any allergies, and be sure they've been evaluated by an athletic trainer. The positioning of this patient is just in a neutral, relaxed position of their foot. You're going to begin by placing 2 anchors on the foot. So preventing too much hyperextension, placing that first distal anchor is going to go around the toe. You want to be sure you're careful of the nail bed if they get this tape a lot. And then you want to add another anchor at the proximal base of the foot. You're going to apply 1-inch strips of tape, and these are going to be check reins, preventing too much hyperextension, but still allowing for some extension to occur. You're basically going to make your way around the foot, going between the 2 anchors, from the great toe to that proximal anchor that you've placed on there. You could even do another one that moves a little more on the lateral side of the foot. And again, some of the number of strips that you place on there is going to be dependent on the size of the patient, but being sure that you're working your way around, kind of fanning out those pieces of tape. Check the motion of the toe to be sure you have them in a good position. And then you want to apply some X strips here. So you're going to go around to the anterior side of the foot, and you want to finish as you're pulling down into a little bit of flexion. So again, preventing that hyperextension. And then a second one of those. Depending on the need of the patient, how much stability you want to provide, you may need to do more of these. I try to limit them, as going around the toe sometimes can be uncomfortable for the patient. Once you finish those, you can close off with some 1.5-inch tape, repeating those anchors that you started at the beginning of the tape job around the base of the foot. Close off those open ends of the tape. And then, as we've done in other tape jobs, we're going to finish off with the Power Flex. Helps hold it in place as the patient participates. And then as we finish the tape job, we want to be sure that we've accomplished our goal and that we still provide enough functional motion for them to go through normal participation. So checking the tape job, but that we're preventing the hyperextension of the toe. And then we'll just have them step down to test it functionally.